Hi, I'm Brigitte, and I am a GP nurse or general practice nurse.
Hi, my name is Jabel, and I would just like to say that coming here to the course really helps me gain confidence to take my exam, especially practicing with the equipment and materials. It feels like I'm at the OSCE Center taking my exam.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
So, kunwari, you have to see this 8-week-old baby for immunization. And then, after nyan, ang next pasyente mo is an elderly with a leg ulcer. So, from 8-week-old baby, ang next pasyente mo is an elderly with a leg ulcer. So, medyo ang laki ng ang laki ng agwat ba na ibang from immunization skill naging wound dressing skill. So ang laki ng shift ng pattern ba ng skill set mo. GP nurse, ang main focus ng GP nurse is prevention at health promotion in a primary healthcare setting. So ang GP nurse, ang workload ng GP nurse, it involves a lot of tests and screens and health education.
Manong knows best.
Nurse, our workload involves blood tests. So if you need a blood test, you will see the GP nurse or the healthcare assistant. So mostly it's the GP nurse that will do the blood test, ECGs, wound dressing, complex wound dressing. So we do the common wound management we do would be the chronic leg ulcers or general wound or post-op wound. So for example, if the patient is had a post-op surgery at meron silang malaking surgical wound, they don't need to stay in the hospital or they don't need to keep going back to the hospital for a wound dressing. They just go to the GP and the GP nurse will do it. And then we also do a lot of childhood and baby immunizations. Meron ding mga travel vaccinations, IM injections. We also do telephone appointments. So if you have high cholesterol, high glucose, but you don't really need medication, so we ring those people we give health education. So maybe you can change your diet, you can change your lifestyle. We also do leg Doppler and ABPI. And also family planning. So if you need contraception, you can also go to a GP nurse for a consultation. And the most common is cervical smear or yung tinatawag natin sa Pilipinas na pap smear.
Manong knows best.
Wala akong previous experience as a practice nurse. Yung previous experience ko is cardiology and medical wards. So nagtrabaho ako sa hospital for 7 years. And then medyo na-attract ako dito sa GP nursing dahil nga sa hours at saka primary healthcare setting siya. Hindi na ako nag-aalaga ng mga acutely ill patients. So I'm just here to do a lot of tests and screenings and health education. So before hindi sila tumatanggap ng without experience as a practice nurse. Pero ngayon, tumatanggap na sila ng mga hospital experience or even newly qualified kasi nga mahirap maghanap ng experienced practice nurse. So willing naman ang surgery namin na i-fund lahat ng mga training po.
Manong knows best.
If you are a newly qualified nurse, you have to do GP nursing foundation course. So I think that's 2 years, 2 years. But it's not full time. You're not gonna be a full time student. You're sometimes you go to the university once a month lang ganon. Pero in my case, kasi meron akong hospital experience, extensive na yung hospital experience ko. So mga trainings na lang ang ginagawa ko kasi competent na ako sa venipuncture, ECG, wound dressing, IM injections. Hindi ko na kailangan gawin yung mga training na yon. Ang gagawin ko na lang yung mga hindi pa ako competent, kunwari yung mga immunization, childhood immunization, travel vaccine, nagawa ko na yan. And then in a few months, I will start my cervical screening training.
Manong knows best.
Yung hours, no weekends, no bank holidays, no national holidays, walang night shift. You just work during the day, which works for my family. It's not very stressful na kasi more on primary healthcare na, hindi na yung mga acutely ill patients yung mga you look after, yun ng mga tests and mga screens na lang. But you also manage minor illnesses and long-term conditions. Pero kung poorly sila, dapat i-send mo sila sa A&E. So usually tatawag ka lang ng ambulance, ganon, or ibubuk mo lang sila ng taxi. Hindi mo talaga sila iti-treat dun sa surgery. Tapos another pro is you can plan ahead kasi during the day, meron ka ng list of patient na makikita. So makikita mo na yung mga skill set na dapat mong gawin. So, for example, half day yung immunization, and then in the afternoon meron kang mga wound dressing. So alam mo na by afternoon gagawa ka ng mga wound dressing or maybe mga injections. Minsan nga kahit Monday pa, makikita ko na kung anong gagawin ko sa Friday. Kasi nakaset na lahat yan. So kunwari merong complex leg ulcer, bukas merong pasyente na merong complex leg ulcer. So before the day before, magbabasa-basa na ako about ulcer or anong mga recommended dressing para sa kanya.
Mummies are wrapped in bandages.
There's a lot of career progression. So hindi ka lang practice forever, pwede ka ring maging minor illness, pwede kang mag-manage ng minor illness, pwede kang mag-manage ng long-term conditions, pwede ka ring maging lead nurse. So depende sa iyo kung anong gusto mo, pwedeng diabetes or COPD, asthma nurse. Pwede ka ring kumuha ng course na prescribing course. So you can be a prescriber. At pwede ka rin maging advanced nurse practitioner, which are, ang maganda din doon is they're all funded by your surgery.
Manong knows best.
So yung cons naman ay, syempre walang enhanced pay. Kasi nga, you're only working during the day. So just basic pay rate mo lang. Walang weekend night shift, ganun. So just basic pay. Sometimes you need more time din kasi kunwari generous naman tong surgery namin kasi kunwari blood test bibigyan ako ng 10 minutes, ECG 20 minutes, wound dressing 20 minutes to an hour. Pero minsan kasi merong mga difficult na mga pasyente, or so kunwari sa blood test difficult vein, so minsan lalagpas ka ng 10 minutes. Kunwari, kukuha ka ng ECG at may nakita kang acute changes sa ECG nila. So, tatawag ka ng ambulance, ganon. Or minsan yung wound dressing, minsan ang na-allocate sa'yo is 20 minutes. Pero actually, lalagpas ka ng 20 minutes kasi masyadong complex yung wound nila. So, yun lang ang I don't want to say stress, pero parang na-anxious ka kasi nakikita mo na yung list ng patients mo na meron ka ng 2 to 3 patients waiting sa waiting room kasi nga na-delay ka. So yun lang, pero ang iniisip ko lang basta I'm doing the right thing for this current patient, nakakahintay naman yung iba kasi wala naman silang sakit yung ibang taong naghihintay. Naghihintay lang naman sila ng mga test. So yun lang, minsan na-anxious ka sa mga naghihintay sa labas.
No pressure.
An extra task list that you have to do, na it's not included in your list of patients to do. Pwede mong pero ang maganda lang doon, you don't need to do it urgently. Pwede mo ring i-add doon sa task list that you have to do on the other days.
A lone, lonely loner.
Lone worker. You're a lone worker. Kasi mag-isa ka sa room, mag-isa ka sa clinic. Although meron kang mga colleagues in the other room or they're just a phone call away, but you are alone there with the patient in that room. So it's up to you. For me, siguro nung first month, it was a challenge for me kasi nasanay ako sa hospital na there's people everywhere, 'di ba? May 4 nurses, may isang senior nurse, may mga doctors, consultants in the ward. Pero dito, ikaw lang talaga mag-isa with the patient. But I didn't had any bad experience naman. So okay naman. At saka meron namang mga panic button kung kailangan mo ng security or kailangan mo ng assistance. Okay naman. You're safe.
Manong knows best.
Nakita ko lang to siya sa NHS Jobs website. Pwede mong i-filter na general practice nurse. And wag matakot mag-apply kasi tumatanggap na sila ngayon ng hospital experience or even newly qualified. Pero I think sasabihin nila or they will indicate na they would prefer an experienced practice nurse, pero they will accept you. They will still accept you if you have good experience, if you have good hospital experience. At saka depende na rin sa interview kung maganda yung communication skills mo, may impress talaga sila sa iyo kasi communication skills is very important in GP nursing.
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.